talk here today about our session, which is coming in a couple of hours. It will be about imaging and physiology. So I think we will start with the physiology part.
Sure. So hello everyone. My name is Dr. Adel Jabri, and in today afternoon session, we'll talk about physiology in coronary artery disease, and we have very good speakers, Dr. Carlos Colot and Dr. Ziad Ali, who have done a lot of research about this important topic. So basically, the main challenging issue that we'll talk about basically the tandem lesions and how to tackle them with physiology. This is sometimes could be confusing, whether you put the wire distally or proximally between the lesions. I think this will be a very interesting talk. And then this also will handle the new concept of what we call the pullback pressure gradient. This is kind of a new concept, basically to tackle the diffuse versus focal stenosis. And as we know, Ahmed, that usually the outcome with focal stenosis stenting is way much better than stenting diffuse disease.
For sure.
I think this will be kind of something interesting that maybe we'll learn today about
sure.
in the afternoon session.
So both, I think, knowing which lesion is the most important one, and then classifying the lesion with the imaging and knowing the exact way you're going to treat it with modification or direct stenting, and the size of the stent and where you're going to place it. It's the main focus of the session, with big names locally and international names, as you just mentioned. I think out of all of this, we're going to have a very good session.
Absolutely. And here will come, I think, the role of imaging, which I think you're going to talk about now.
For sure.
Which is IVAS, I think, guided stenting.
Right, yes. IVAS or OCT for the left main and bifurcations as well.
Absolutely. So do you use more IVAS or OCT in your practice?
I use both, to be honest. It all depends on the lesion itself and the patient himself. So it's going to be OCT or IVAS. If I gonna use contrast or not, I expect a lot of calcium or not, it's a left main or not as well. But any imaging is better than no imaging. This is what the study showed, and the expertise in the image itself, the way interpretation as well, gonna limit the use of imaging. Which modality you're gonna use?
Absolutely. I think one of the burning questions that we'll maybe address today are also about assessment of left main stenosis. Especially the borderline, using physiology, imaging, or maybe combination.
Yeah, we're gonna leave that for the session, though. Absolutely. It's because I think it will create a lot of buzz.
Absolutely.
Thank you.
Thank you.
Looking
Ahmed.
forward for the session, Adi.
Thank you very much. Thank you.